Afternoon. Pete Wildebohr,
Present.
Pat Bradford,
I am here.
Josie Barnhart,
Here.
Stephanie Craybill, Melissa Mason,
Here.
Hugh McManus, and Stephanie Walker.
Thank you all for being here. We will carry on now with the approval of the agenda. Do I hear a motion to approve the agenda? Thank you, Ms. Walker. Is there a second? Thank you, Ms. Barnhart. Any discussion? If not, all in favor, please signify by saying aye. Aye. Any opposed? Passes 6-0. And we'll give you the keys to the car. Ms. Miles, you're on. Thank you.
Thank you so much for having me tonight, this opportunity to talk a little bit more about Head Start. It is a required training from our federally funded program, Head Start. So program governance training is happening tonight for board members, and it happened in November for our policy council, who consists of parents. Let me get my little clicker here.
Can we shut the doors?
Can we have that door in the back shut, please?
Is this?
Yeah, just kind of loud. Thank you.
Green button, okay. No?
Yes.
Well, when you get old, then I have to use my other glasses.
Yes.
Thank you.
All righty. And there we go.
So I made a copy of the agenda for you board members as well. So we're going to talk about a little 101, just briefly. Talk about shared governance, which is policy council and you, and a closer look at the bigger picture of what we do in New Hanover County Schools with early childhood education. We have multiple programs, so we're going to look at those closer. We are going to talk about federal reviews, introduce those, and we're going to allow some space for some Q&A. So Head Start is a federally funded program, and it focuses on 3 umbrellas, which is health and nutrition, including mental health and dental, early care, which is education, as well as family engagement. So we have 3 and 4-year-olds served in Head Start programs. It's an application process, which is very important to communicate out. Not everybody gets accepted. You have to qualify. We are required to maintain a 10% IEP count, individuals' education plans. So 10% of your population, of your 260, must have IEPs. In North Carolina, over 21,000 students are served with Head Start grant funds, and we have 53 grantees in North Carolina. Out of those 53, there are now 15 LEAs. 5 years ago, there were only 10 LEAs. So we are growing. And it's important to note that we are audited by the Office of Head Start, as you are shared often information about that. And we follow the regulations of your Head Start program performance governance standards. Our Regional 4 office is North Carolina, and it's located in Atlanta, Georgia. So a lot of the things that we do are out of state, and this is why. So shared governance. So it's required, and it's with policy council, parents, and board members, which you guys are the winners. And the term is between 2 bodies, shared decision-making and planning and getting involved and being transparent and communicating and overseeing the operations of the program. And that's you guys. Board of Directors, New Hanover County Board of Education, board members. It's the group that has the legal and physical responsibility of the Head Start program and other agencies within the program. Board composition. So we are an LEA program. So in your Head Start program performance standards, it states that LEAs are exempt from this requirement, but when we look at our policy council, we ensure that at least one member has one of these backgrounds. And of course, we have a board attorney as well. But we are exempt because you're elected officials. I think it's important to keep this slide in here just so that you're aware of it when we go into auditing purposes, that we do have a waiver. So one of each member they recommend has a background in early childhood education, an attorney, and fiscal. Policy Council composition. Currently, our Head Start funding is at Johnson Pre-K Center only. So the parents of Johnson Pre-K Center make up the composition of your Policy Council, along with 5 community members, in which we invite Department of Social Services, Health Department, Early Childhood Education representative, and someone with a fiscal background. And we have to ensure that there are more parents present than community members in order to have a quorum. This enables parents to be a part of the shared decision-making and a part of their child's education and the plans for the program. So, very important to look at your community and who's involved with that. Enables our parents to have a voice. Board liaison role. So we do have Josie Barnhart, who's representing our board liaison role. And so she is tasked with ensuring that we communicate between both governing boards, Policy Council and Board of Education meetings. We facilitate the shared governance process, and she is required to do monthly reporting to the board. How we do that can be locally defined by us. Shared responsibilities, approved procedures, plans, service plans that were approved in the fall, bylaws, composition of your policy council, which was approved early summer, administer and oversee the Head Start program and safeguard federal funds, which is shared monthly, participate fully in planning and evaluating of all of the Head Start program, and ensure that we're in compliance. Must approve annually program service plans, self-assessment, many other procedures that are additional from New Hanover County Schools. So, selection criteria. Most of these documents are presented at the refunding or the grant renewal cycle in January or February. So you have to approve how we select our students. Now, the federal government and the state criteria and requirements are on the site selection score sheet, but we approve that locally as well. And of course, annually funding, and then human resources reports. So when we hire Head Start staff, Policy Council, and Board of Directors approve those staff members with, of course, the recommendation of the interview committee. That's why you have us. Information reporting and sharing. So these are what's required. Financial statements, which is on your Head Start liaison report that you receive monthly, must be shared. There is demographics and program reporting that must be shared, including attendance, where are we at with exciting things that are happening in the program. We even add highlights of the program and the school, both highlights, and then monthly reporting on meals and snacks, which we are a CEP school at Johnson Pre-K Center, so all of our breakfast and lunches are free to our students. And then, of course, participating in training on their roles and responsibilities. I feel it's important as a director of the program of early childhood education for New Hanover County Schools to look at the big picture. We're not only Head Start. We serve over 1,000 students now. We have 9 public school sites, 10 private sites that we oversee, and over 63 classrooms. We are the Head Start grantee, the NC Pre-K contract administrator for the state. And we have an amazing partnership with our local New Hanover County managers. So with saying that, this speaks loudly to our community that we have a one-point entry application process, meaning our families come to one office. They come to New Hanover County Schools to enroll. In some counties, this looks very different. Head Start is managed by a different agency. We're under all one umbrella, so we touch all of these children. Mandated curriculum, creative curriculum. We have enhanced curriculums that are supported by our superintendent and senior leaders that are going to help us boost up our math and literacy skills. And we also are mandated to follow North Carolina's state standard course of studies, which is NC FELD, in addition to SEL, which is social emotional learning. Formative assessment is mandated, and we use teaching strategies as the platform for all of our programs to make it unified. We do checkpoints at the beginning of the year, the middle of the year, and at the end of the year. And we look very closely at the progressions of this data. And we are proud to say that we have full inclusion with our administrators at our pre-K centers, and that's a huge win for us. We're looking at that data. We'll look at that again at the end of the year in July like we did last year for the whole program. We're family focused because we know that works. You need to have relationships with your families in order to teach their children and work with them, and we need to go to them. We do home visits, we do family conferences, and we do family engagement events, many. Health is so important to good early intervention. If our kiddos don't feel good, their teeth are hurting, we're not gonna learn. We're not gonna get to the academic piece. Head Start requires exams. Your other programs require screenings. Head Start requires the exams, and we do that in partnership with our dental mobile unit. It is so cute. So looking at our classrooms, important to note that our grant that we do every year is for 3- and 4-year-olds. Not every county does that. Head Start serves 3- and 4-year-olds. We're at Johnson Pre-K Center, and we have a BK licensed teacher or a pre-K add-on teacher in addition to a teacher assistant present. 2 adults in the room at all times, low ratios, no more than 18 per classroom. If we have majority of 3-year-olds, that changes to 15 to 16, depending on the age of your children. We're housed underneath the Division of Instruction and Accountability with other federal programs, which is a great match for us. We're almost at $3 million, and we are granted 260 children. We cannot overexceed 15% of our budget for administrative costs, so we do a very good job with the 6%. Majority of our money in Head Start goes to classroom salaries for state salary paid. And we are a direct service grant, which is a lot different than your Title I and other federal grants. It does not go to DPI at all. It comes straight to us. Important to note, specialized services. Culturally responsive programming in our standards, we have to do that, and we do that well. Mental health, observations, we make referrals, we get them services on site. We partnered this year with Department of Social Services, with housing a mental health, licensed mental health person at Johnson Pre-K Center who has a full caseload. It's a big shout out for that. Often teacher assistants will serve as the bus monitors. Bus safety is very important. We have little feet, little legs, and we now have a site instructional coach. We do heights and weights, beginning of the year, middle of the year, and at the end of the year of all students. So what does that say to us? Some of our BMI reports, we might be overweight, we might be underweight. So what we do is we develop plans to work with the families to get their BMI weights at a healthy average weight. We look at that very closely. And how do we do this locally with the liaison board member? We do monthly Head Start liaison reports. That's what New Hanover does. We do required data reporting and expenditure reports on this liaison report, and it's emailed to all board members. How we do that can be locally defined differently. If we think it's working, we can change what's not working and continue what's working. And then, of course, quarterly updates with members and the public. Federally monitoring process is not a choice, and it's good. If we're going to take $3 million, we need to be monitored. We're on a 5-year grant cycle based on 5 major reviews. So class and comprehensive services for school readiness. Class is an observation tool that we do at the beginning of the year, middle of the year, and at the end of the year at Johnson Pre-K Center. This observation tool focuses on instruction, classroom organization, and emotional support. The big takeaway from this tool is it really analyzes how teachers are engaging with our students with a positive climate. We're 3 and 4. This needs to be happening. Environmental health and safety, every day and reported monthly. Of course, fiscal integrity. What are we doing with the money? And then IRSA, which is your enrollment, recruitment, selection, and attendance. You approve the scorecard that we do every year. So that's a part of that process. And then the management systems of governance, which is you guys, along with the policy council. It's important to share with you that we're ending grant year 05 in April 2024. We will start new project May 1, 2024. What does this mean? This means a lot of work needs to happen before then. We're going to start this work in July. We're finishing up a community assessment that we partnered with, along with the self-assessment to use some data-driven triggers. This gives us the opportunity to start a new grant based on the needs that we really need, because it's changed a lot in the last 5 years. We have an opportunity to ask for more money per child, and we will. We have an opportunity to ask for those resources that are necessary to be successful in early learning, and to look at a lot of different pieces that we weren't able to look at when we were in the 5-year grant year cycle. So we're going to ask for some support, community letters, of course, and finish really big, start over with our strategic goals. So that's important to note, that we will be starting a new grant year as early as July. Any questions?
You mentioned back in the beginning of the presentation that 10% of the enrollment must include IEP children. Is that a state mandate, or is that something that the county decided on?
Great question. That's in your Head Start program performance standards.
Okay.
So we're taking this money and we're saying within that population, we're going to ensure 10% by the end of the year.
So my next question, sorry. Are you at that 10%, or are you above that 10%? Or are you not quite there?
Typically, we're above it. Last year, we ended up with 32. This year, we're currently at 23. And it's May. Well, it's April, but in my head, it's May.
Anyone else?
So a lot of students are in the evaluation process, which takes time.
McManus?
I was just going to ask about the tablets.
Ooh. So we do have a highlight to share. Tomorrow, we have a planning meeting with AppSeed, which has started a partnership with Dr. Faust and his team to provide seedling devices to our Head Start students at Johnson. So we're going to start some planning tomorrow afternoon, and this device will be handed out to everyone that attends Johnson Pre-K. So we have about 300 students, including NC Pre-K and EC special ed students there, and they all get this device. And what does that mean? So this device is, it comes with a part-time position that will be doing check-ins, assessment points, that we're going to be very helpful with using our teaching strategies data to help with that, to see in these areas of literacy and math, is the focus of the devices. And she'll do check-ins to see the growth of when we started out and when we ended with these devices. And it's specific skills that the sibling, the devices, that they can do games with. So, and we are planning, we want to get that rolled out the end of April so that it gives us some of our children who are going to kindergarten a chance to do some play and get some data on that. But it's an 18-month partnership, so it will continue next year as well.
Great. Anyone else? Ms. Barnhart?
Thank you, Ms. Miles, for being here. So mine is, since we're going to be looking at the new grant cycle, and it's a 5-year cycle, and you mentioned a few things, but the strategic plan essentially for what you guys are doing, because we're grant funded, will all of the curriculums and the strategic plan, that all be reworked into this new ask, I guess, for?
Yes, it's
grant
required.
fulfillment? Okay.
And again, another opportunity to refresh and to pick us up where we're at now, because we've made great strides.
That's really where the policy council is going to put their heads together. Okay.
And it'll be very helpful because we'll be looking at New Hanover County Schools strategic plan and making that in alignment with our new grant.
Okay, great.
Awesome.
And of course, we need to ask for more money.
That's good. That's good. Anyone else? If not, Ms. Miles, thank you.
And please call me anytime if you have any questions. Would like to share with you, we did start enrollment for next year, but placements will not go out till May. So I know we have happy parents that want to know now. So we are asking for grace as we have multiple programs underneath one umbrella, and we got to make sure everybody's good to go because we have to qualify. But we are going to let them know as soon as May. Thank you very much.
Thank you, Ms. Miles. We appreciate it. Great program and a great presentation. Thank you very much. At this time, I would entertain a motion to adjourn, because I don't think we have any other business for this training.
So moved.
Bradford makes the motion. A second?
Second.
Ms. Mason makes a second. All in favor, please signify by saying aye. Aye. Any opposed? If not, we are adjourned.